Hello guys, Assalamu alaikum. It's Dr. Faraz Ahmad, and today in this video we will discuss about OET reading part B. So in this video I will tell you about 6 different extract or the text given in reading part B. I will also tell you about different strategies how to solve reading part B, and we will also discuss 6 examples in this video as well. So let's move to the video without wasting any time. Guys, as I have already told you people that reading test basically consists of 3 parts: part A, part B and part C, and you have 1 hour to solve 42 questions out of these 3 parts. And to get B or to pass the reading exam, you have to score 30 marks out of 42 questions. So keep in mind 30 marks to pass reading exam. So both reading part B and part C both have 45 minutes in combined, so you have to manage the time properly. And keep in mind that reading part B consists of 6 extracts from work-based communication in a healthcare setting. There are 6 texts or 6 extracts are given in part B. Each consists of 150 to 200 words. Keep in mind 6 extract and 6 question. There will be 6 questions, that is 1 question from each extract, and these questions will be multiple choice type of questions. And there is one other important thing, that question in part B will be multiple choice question with 3 options each, and 1 option will be totally wrong, irrelevant to the text. 1 option will be out of the text, so the third and the remaining option will be your answer. So while you are solving the reading part B, keep in mind that the 1 option is out of text, so leave it. 1 option is totally wrong, and third and the remaining option will be your answer. So apply this strategy while you are going to solve reading part B, and you have to spend approximately 10 to 12 minutes in reading part B, that is 2 minutes on each extract or question. And most of the students lose their marks in reading part B and C. This is because they don't practice both of these parts. So now I will tell you about the strategies how to tackle or how to cope with reading part B. So first of all, you have to read the question. Read the question and underline or encircle the important word in question, the phrase given in the question, and you have to search that word or the synonymous of that word in extract, and it will be your answer. So first of all, you have to do what? You have to read the question and underline or encircle the important word or phrase in the question. Then read the extract. After reading question, don't read options. Then read the extract carefully and search the important word or the phrase given in question in the extract. Then read the option and then answer carefully. Apply the strategy which I already told you, that 1 option is out of the paragraph, the other option is totally wrong, the third and the remaining option will be your answer. So these are the strategies. Always apply these strategies to score good marks in reading part B. And you have to score at least 4 marks out of 6 to get you at a safer side. Okay? Okay guys, let's discuss some examples about reading part B of OET reading test. And keep in mind that don't waste your time in reading the 2 lines given above. In this part of the test, there are 6 short extracts relating to the work of health profession. For question 1 to 6, choose answer A, B or C, which you think fit best according to the text. So don't read this, just simply directly go to the question number 1. So let's start practice now. What is question number 1? Nursing staff can remove the dressing if. So what is the important word in this question? Encircle or underline the word. The important word in this question is remove. Nursing staff can remove dressing. So when we can remove dressing? So this is important word in this question. So leave the options now and move directly to the text and read it. Dressings are important component of the post-operative wound management. Any dressing applied during the surgery have been done in sterile condition and should ideally be left in place. Okay, it is acceptable for the initial dressing to be removed. So this is a word removed. This word was already given in question. Search for your answer. Removed prematurely in order to have the wound reviewed. Okay, and in certain situations. So what are the situations? These situations include when the dressing is no longer serving its purpose. So what are the purpose now? Dressing falling off, okay, excessive exudate soaking through the dressing and resulting in a suboptimal wound healing environment, or when a wound complication is suspected. So when we can remove dressing, when wound we have to review the wound, and when there are some other conditions like dressing is falling off or excessive exudate from the dressing. So let's move to the options now. So option number one, option number A, a member of the surgical team is present. There is about the surgical team member was not discussed in the text. There is a severe leakage from the wound. Oh, this is talking about exudate. Okay, let's read the option C. They believe that the wound has healed. Wound has not healed. This is a very first post-operative day we are discussing about. So option A isn't given in text. Option C is totally wrong. The option we left with is B. There is a severe leakage from the wound. So this is our answer. Answer is B. So nursing staff can remove a dressing if there is a severe leakage from the wound. Okay, answer of question number 1 is B. Let's discuss about example number 2. Let's read the question. As explained in the protocol, the position of the RUM container will ideally. Okay, now he's asking about position of RMU container. Keep in mind what the question is about. Question is about the position of container. Okay, let's read the text. A returned unwanted medicine RUM project approved container will be delivered by the wholesaler to the practicing pharmacy. Okay, the container is to be kept in section. So container is to be kept. So this he is starting to talk about the position of container. Be vigilant and read carefully. Kept in a section of the dispensary or in a room or in enclosure in the pharmacy to which the public does not have access. Okay, public shouldn't have access. The container may be placed in a visible position. But out of range of the public, as this will reinforce the message. Okay, visible position will reinforce the message that the unwanted prescription drugs can be returned to the pharmacy and that the returned medicine will not be recycled. Okay, let's move to the options now. Option A, encourage the participation in the scheme. Okay, emphasizes the value of recycling. We are not talking about recycling in the text, so this is a wrong option. Okay, facilitate the public access to it. We should avoid public access. Option C is wrong. Option B is out of text. So what we have left with option A. So our answer is option A. Position of container will ideally encourage the participation to the scheme. Okay, our answer is A. Okay guys, let's start with example number 3. The report mentioned in the memo suggests that. So he's asking about suggestions given in report. Okay, so let's discuss, let's read the text. Report on the oral anti-cancer medication. Nurse, unit manager are directed to review the system for the administration of oral anti-cancer drugs and the reporting of the drug errors. Serious concerns have been raised in recent report drawing on the national survey of the pharmacist. Please note the following paragraph quoted for the report. Okay, so our answer will be in this paragraph now. Okay, incorrect dosage of the oral anti-cancer medication can have the fatal consequences. Over the previous 4 years, there were the 3 deaths and 400 patients safety issues involving the oral anti-cancer medications. Half of the reports concerned the wrong dosage. Okay, frequency, quantity, and the duration of oral anti-cancer treatment. A further concern is that the errors on the part of the patient may be the underreported. Okay, errors on a part of patient may be underreported. In light of these reports, there is clearly a need for the improved system covering the management of the patient receiving the oral therapies. Okay, now let's move to the options. Option A, data about the patient error may be incomplete. Okay. Option B, error by the hospital staff can often go unreported. No. Over the previous 4 years, reports in previous 4 years show that there were 3 deaths and 400 patient safety issues regarding the hospital staff. Okay. Errors in prescription pose the greatest threat to the patient. Okay, so errors by the hospital staff can often go unreported. This is wrong. Errors in the prescription pose the greatest threat to the patient. This is not given in text. And data about the patient errors may incomplete. This is the option. Read in second last line that errors on the part of patient may underreported. So data about the patient errors may incomplete, underreported or incomplete. So these are synonymous words and we have to search for these. So our answer is A. Okay guys, let's discuss example number 4. Let's read the question. What point does the training manual make about the anesthesia workstation? So in this text we have to search about the point about anesthesia workstation. So let's read the paragraph. Study on the safety in anesthesia have documented that the human vigilance alone is inadequate to ensure the patient's safety, and have underscored the importance of monitoring devices. These findings are reflected in improved standard for the equipment design, guidelines for the patient monitoring, and reduced malpractice premiums for the use of the capnography and the pulse oximetry during the anesthesia. Anesthesia workstation. So here is the word, here is the key word, anesthesia workstation. Most probably our answer will be in upcoming lines. Anesthesia workstation integrate ventilator technology with the patient monitors and alarms to help prevent the patient injury in unlikely event of the ventilator failure. So what happened in ventilator failure? Alarms. Okay. Furthermore, since the reservoir bag is part of the circuit during the mechanical ventilation, the visible movement of the reservoir bag is confirmation that the ventilator is functioning well. Okay, let's read the options now. Option A, parts of the equipment have been shown to be vulnerable to failure. I don't think we have read this in paragraph. Okay, let's move to the option 2. There are several ways of ensuring that the ventilator is working effectively. Yes, I think. Okay, let's read option 3. Monitoring by the health professional is a reliable way to maintain the patient's safety. No, this is totally wrong. Monitoring by the health professional is not reliable. Okay, and now let's move to the we have excluded the option C. Option A, parts of the equipment have been shown to be vulnerable to failure. No, I don't think this is answer. Part B, option B, there are several ways of ensuring that the ventilator is working effectively. Yes, there is a reservoir bag. The proper functioning of a reservoir bag confirm that the ventilator is functioning very well. And oh yes, there is alarm as well in ventilator. So alarming of ventilator and movement of reservoir bag, these confirm the ventilator is functioning well or not. So our answer is B. What is B? There are several ways of ensuring the ventilator is working effectively. Okay. Let's move to the question number 5. In case of snake bite, the flying doctor should be aware of. So he is going to tell something about snake bite in this paragraph. So let's discuss. Let's read the text. Before starting the treatment, don't wash the snake bite site. If possible, determine the type of the snake bite by using the snake venom detection kit to test the bite site swab, or in systemic envenoming the person's urine. If venom detection is not available or has proven negative, seek advice from the Poison Information Center. Okay, testing blood for the venom is not reliable. Assess the degree of the envenoming. Not all confirmed snake bite will result in the systemic envenoming. Risk may rise with the species of snake. Okay. People with a pre-existing renal, hepatic, cardiac, respiratory impairment and those taking the anticoagulant or the antiplatelet drug may have an increased risk of the serious outcome from the snake bite. Children are also at increased risk of the severe envenoming because of the smaller body and likelihood of the physical activity immediately after the bite. Okay, let's move to the options. Option A, where to assess the specific antivenom. We have discussed something about antivenom. Seek advice from the Poison Information Center if envenoming is negative. So this is wrong. Option B, the appropriate method for the wound cleaning. Point 1 was do not wash the snake bite site. So this option is also wrong. So point C, the patient most likely to suffer complications. Okay, so where to assess the specific antivenom? Option A is not given in text. Option B, the appropriate method for the wound cleaning, we have not to wash the wound. So option B is incorrect. The option C, the patient most likely to suffer complications. So what was the question? In case of the snake bite, the following doctor should be aware of. He should be aware of the patient most likely to suffer complications. He should be aware of about the patient premorbid condition, if he have renal, hepatic, cardiac or respiratory problem, if he is a child. Okay. So I think our answer should be C. Let's move to the last question and the last example. What was the purpose of the BM Tech Forum? So in this text we have to search for purpose of BM Tech Forum. So let's read the text. Clinical audits. 3 rounds of the environmental cleaning audit were completed in 2013 to 14. Key personnel in each the facility were the surveyed to assess the understanding of the environmental cleaning from the perspective of the nurse unit manager, environmental services manager and the director of the clinical governance. Okay. Each facility received a report about their environmental cleaning audit and lessons learned from the surveys. Data from the 15 units were also provided to the each facility for the comparison purpose. The knowledge and experience from the audit were shared at the BM Tech Forum. So here is our answer. We have to search for purpose of the BM Tech Forum. Okay, BM Tech Forum in August 2014, the forum allowed environmental service manager and cleaners, nurses and clinical governance to discuss the application of standard and promote new and improved cleaning practice. Okay. The second day of the forum focused on the auditor training and technique with the view of the enhancing internal environmental cleaning auditing by the participating groups. So in this text what were the purposes? This forum allowed environmental services managers and governance everyone to discuss the application of standards, okay, and promote new and the improved cleaning practices, okay. And third purpose was focus on auditor training and technique with the view of the enhancing internal environmental cleaning auditing by the participating groups. Okay, let's move to the options now. Option A, what was the purpose of the BM Tech Forum? Option A, to propose a new way of carrying out cleaning audit. No, we haven't discussed any ways or any means of auditing in this text, so this couldn't be our answer. Option B, to draw the conclusion from the result of cleaning audit. What was the purpose? Purpose was to allow them to apply the standards and promote the cleaning. And the third purpose was enhancing the internal environmental cleaning auditing by the participating group. Okay, so option B is incorrect. Option C, to encourage the more groups to undertake the cleaning audit. So here is our answer, encourage more groups. Enhancing and encouraging us both are the synonymous, and participating groups. So here is our answer. We have to pick these words, encourage enhancing the groups. So to encourage the more groups to undertake the cleaning audit is our answer. So answer of the option, answer of the example C is example 6 is C. Okay guys, so guys, this was all about reading part B. I think this is a easy part as well, because you have 2 minutes to read the text or the paragraph of 150 to 200 words, and you can easily read it in 1 minute and 20 seconds, and you have 40 seconds to answer the question. So guys, keep practicing. Inshallah you will get good marks and you will clear your OET with minimum B grade. Remember me in your prayer. Thank you very much. Bye bye. Allah Hafiz.